guys, welcome to our YouTube video about type 1 diabetes mellitus. Have you recently been diagnosed with type 1 diabetes? Do you find that daily insulin injections are messing with your freedom and lifestyle? Keep watching this video as a team of nursing students explain to you what diabetes is, treatment options and how the treatment options affect quality of life, general fears and anxieties, hypoglycemic and hypoglycemic episodes, community support available to you, and what are HbA1c results, and how the right treatment option for you will give you more free time, flexibility, and most importantly, the ability to be like a normal teenager. So let's start with, what is type 1 diabetes? It happens when your pancreas, which is a large gland behind your stomach, stops producing insulin because your autoimmune system is activated to destroy it. Insulin is a hormone that is produced by the pancreas. It basically takes the glucose from the food we have eaten and moves it into cells that store and uses the glucose for energy. Type 1 diabetes mellitus is more likely to happen in your childhood or adolescence and is unfortunately a lifelong disease. But do not worry, the information we have gathered will hopefully help you find the treatment that is perfect for you. Symptoms to look out for can be excessive thirst, losing weight without trying, feeling tired, and blurred vision. So now let's have a look at some treatment options.
Continuous subcutaneous insulin infusion, insulin pump, or multiple daily injections. Insulin pumps are battery-operated, portable electromechanical devices used to deliver insulin into your subcutaneous tissue, normally into your tummy. Bolus infusions initiated by the user may be given on top of the preset basal rate of insulin through your insulin infusion pump. The device has an insulin reservoir and infusion set of which a small cannula is inserted into your tummy, connecting you to your pump. Advances in devices now allow for real-time continuous glucose monitoring, discontinuing the need of self-monitoring through fingertip pricks and blood glucose level devices. Daily injections of insulin means diabetics are having to test their blood glucose levels, draw up insulin, and inject insulin into their subcutaneous tissue. This all requires using blood glucose level devices with test strips, lancets to prick their fingers for the test strip, insulin vials or pens, needles for injections from pens, and privacy. It is then recommended that the diabetic also have more than one BGL machine and carry this equipment with them wherever they go. In one review article comparing insulin pumps to multiple daily injections, it is recommended, from the gathering of the evidence, that in both adult and pediatric patients with type 1 diabetes, the use of CS2 allows better glycemic control, better customer satisfaction and quality of life, and decreased risk of hypoglycemia than MDI.
How the treatment options relate to quality of life and effects on the family. The use of insulin pumps has shown to improve psychosocial functioning in children and young adults with diabetes. It has improved self-efficiency with diabetes management. Self-efficacy is an important factor for treatment satisfaction. Research shows that patients on insulin pumps have higher diabetes self-efficacy compared to those on multiple daily injections. In a recent study, adolescents like you who used the continuous insulin pump had a higher quality of life. This means that they had higher physical, emotional, social, and school functioning. They even suffered less stress than those with multiple daily injections. This is most likely because the insulin pump does not disrupt normal day-to-day living like multiple daily injection would. The insulin pump allows you to live a very normal teenage life. Improved treatment satisfaction with pump therapy might be due to improved metabolic control. A study on pump treatment showed lower HbA1c compared to the multiple daily injections. The pump used is portable, meaning you can take it wherever you go, no hassle or fuss, and added flexibility. You would have the benefit of flexibility to make various adjustments to suit exercise, various types and timings of food, various dose, and different basal rates and patterns required. Insulin pumps offer greater ease with meal coverage and hyperglycemia correction. This is particularly the case outside home. Researchers found that more patients on pumps are satisfied with their treatment in this regard, as they have higher mean score of satisfaction related to feasibility of use of correction boluses or bolusing for snacks, decreased sense of physical and dietary restrictions. To reduce micro and macrovascular complications, individuals with type 1 diabetes can look towards continuous insulin injections. The amount of episodes of severe hypoglycemia was shown to decrease in the 2 years after the start of pump therapy in both young and older children. Over years of continued follow-up, the rate of hypoglycemia was 30% lower in the pump users versus the injection users. The reduction of parental stress and improved family relationships seen with insulin pump use has a positive impact on the overall quality of life and the health and well-being of young adults and children with diabetes and the family.
Whether or not you have an anxiety disorder, living with diabetes is enough to make you feel anxious or depressed. You may struggle with a range of mixed emotions across your daily tasks, such as feeling of fear, anxiety, anger, denial, and sadness. Or you may have some concern about how diabetes affects your life. As you have to perform a routine for careful diet, exercise, and regular glucose monitoring, and self-injection as well. However, what may surprise you is that you can live a normal life as your friends do, but you just need to be more careful about planning your daily tasks. Within the diabetes literature, it shows that the sudden level of anxiety and depression in children and adolescents with type 1 diabetes is nearly double that of estimated depression in general use, leading to disruptions in optimal diabetes management and poor glycemic control. How do you manage your anxiety and depressive symptoms? The best thing is to learn coping strategies to help you manage your feelings. Whatever works best, such as exercising regularly and having an adequate sleep, or actively express how you feel to your family or friends.
Adolescents who suffer from type 1 diabetes have to continuously monitor their blood sugar levels throughout their day. This is to ensure hypoglycemic and hyperglycemic episodes do not occur without them knowing. Therefore, they can treat it with insulin if need be. The primary goals in hospitals to manage these episodes effectively, they undergo immediate assessment and stabilization of their airway. Immediate assessment includes placing patients on oxygen, measuring their O2 saturation, and cardiac monitoring, as well as obtaining vital signs, a fingerstick glucose, intravenous access, and a 12-lead electrocardiogram to evaluate arrhythmias and signs of hyper and hypochlamydia. Before patients leave hospital, it is promoted to the patient to apply for continuous blood glucose monitoring systems. The eligibility for these systems include being a type 1 diabetic, either aged up to 10 years old and can benefit clinically, aged 11 to 21 years old, benefit clinically, and the family is to participate in using the monitor, and frequent hypoglycemic episodes occur. Applying for this will allow the adolescent to monitor blood glucose levels continuously, therefore being able to reduce the possibility of hypo or hyper episodes. Education to support self-management is an integral part of diabetes care. Patients and their carers should be offered a structured, evidence-based education program at the time of diagnosis with an annual update and review. Our community offers many resources which can assist in the management of type 1 diabetes. The National Diabetes Services Scheme is what subsidises the glucose monitoring systems for eligible diabetics, online resources which educate diabetics on what to look for when a hypo or hyper occurs and how to treat it themselves to avoid it getting worse, daily changes they can make to their lifestyle, and medications best utilised. These online sources include Diabetes Australia and the Primary Health Network. Also, endocrinology specialists can promote many ways to live with the type 1 diabetes and provide extra support, as well as many support groups within the community to ease the struggle of living with diabetes as an adolescent.
Let's find out what HbA1c means. Our blood is like a moving train with various important parts with their own functions. RBC is one of the components made of hemoglobin. The train cannot run without fuel, similar to our cells without glucose. Glucose and hemoglobin stick together to form glycosylated hemoglobin known as HbA1c. In addition, if there is overload of fuel in train, it produces negative issues. So when HbA1c level is greater than 36 millimoles, that is 5.5% in our body, it develops diabetes. To stop the overload of fuel, the continuous subcutaneous insulin infusion is very effective as per various resources. It reduces the mitral and macrovascular complications. It delivers insulin to match the individual's needs, doses to cover meals in order to prevent overload. Study shows episodes of severe hypoglycemia decreased from 32.9 to 11.4 per 100 patients a year. Another study revealed that people with positive attitude with insulin pumps improved their HbA1c level ranging 41 to 70 millimoles, whereas ones with negative attitude also improved their glucose level ranging 32 to 72 millimoles in average.
Okay, so we're all done. During this video, we showed you some pretty cool facts about diabetes mellitus type 1. Hopefully you discovered what diabetes mellitus type 1 is and how the HbA1c levels show you how high or low your hemoglobin is. Don't forget the reasons why continuous insulin injections gives better HbA1c results. Do you remember the symptoms of diabetes? Do you have any of these symptoms? What about the treatment options? Remember how you can either treat diabetes type 1 with multiple daily injections or a continuous insulin infusion pump. Try and think about which of these options suit you and your lifestyle best. Do you feel like diabetes type 1 is killing your freedom? Think about trying out an insulin pump. Remember how it can give you more freedom, less anxiety or stress, and the ability to be a normal teenager? There are a few common fears and anxieties that can go side by side with diabetes. Do you remember what they include? Do you have any of these fears? Remember, there is heaps of support out there for you, such as your local hospital or university, doctor, and even your community. So try and have a chat to some knowledgeable people about fears you might have. They can give you information and help you deal with your diabetes.